Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Introduce myself. My name is Wildan Ahmil K, and today I will be your moderator in this kind of presentation from Group 4. We will talk about World Health Organization right now. We are from Group 4. We have 4 group members. The first one is Siti Hasanah, and the second is Yuni Sobariah, and the third is me, and the fourth member is Zidan Danar R. So let's move to our main session in this presentation. The first section is about WHO or World Health Organization. The first section will be presented by Zidan Danar R, and right now I invite Zidan Danar R to present your section.
Profile of World Health Organization. The World Health Organization, often abbreviated as WHO, is one of the United Nations agencies acting as the international public health coordinator and is headquartered in Geneva, Switzerland. The World Health Organization, or WHO, is an agency under the United Nations responsible for international public health issues. The organization was founded on April 7, 1948. As we know, this birthday is commemorated as World Health Day. Each country can become a member of WHO without exception. Unification countries wishing to become WHO members must sign or accept the content of the World Health Organization consignment. World Health Organization works around the world to promote health, safeguard the safety of the world, and serve the vulnerable. Currently, WHO has 193 member countries. The organization has 6 regional offices and 149 offices at the state level. As an institution with various countries as a member, WHO established 6 official languages, include Arabic, Chinese, English, French, Russian, and Spanish. Supported by 700 employees around the world, it works closely with governments and agencies to realize sustainable health for everyone. To carry out its activities, WHO receives funding from member countries and contribution from voluntary donors. World Health Organization has a principle in its formation. The first is health is a complete physical, mental, and social condition, and not just the absence of disease. Second, enjoying the highest healthy standard that can be achieved is one of the basic rights for every human being, regardless of race, religion, political belief, or social and economic condition. Third, everyone's health is the basis for achieving peace and security and depends on the full cooperation of each individual and country. Fourth, each country's achievement in health promotion and protection benefit all. Fifth, unequal development in various countries in promoting the health and control of diseases, especially infection diseases is dangerous to all. 6. Health child development is one important thing. While the ability to live harmoniously in a completely changing environment is important for the development. 7th, the widest spread of medical, physiological, and related knowledge to everyone is essential to the achievement of full health. 8 is clearly conveyed opinions and active cooperation is part of the community are the most important thing in efforts to improve public health. And the last, the government is responsible for the health of its people, which can only be fulfilled by determining adequate health and social measures. Incumbent of World Health Organization. World Health Assembly consists of the envoys of each member. For executive board, they have 34 people elected every 3 years. In the Secretariat, Dr. Tedros Adhanom Ghebreyesus is Director General of World Health Organization. He is Ethiopian and incumbent since 2017. For Deputy Director General, WHO have Dr. Susanna Jacob, incumbent since 2019. And for Chief of Staff, there is Dr. Bernhard Swartlander, and he incumbent since 2017. For Executive Director, there is Jenny Allison. For External Relations and Governance, and there is Dr. Michael Ryan, is WHO Health Emergency Program, and there is Dr. Peter Salama for Universal Health, and there is Dr. Soumya Swaminathan for Chief Scientist Sector. And for Regional Director from America is Dr. Masidiso Rebecca Mueti, incumbent since 2015, and from Americas is Dr. Carissa F. Etienne, incumbent since 2012.
Okay, thank you so much for your presentation, Zidan Danar, and it's very informative and very useful information that being given by Zidan. So let's move to the next section. Is the section 2 is about history of WHO or World Health Organization, who will be presented by Siti Hasanah, and I invite Siti Hasanah to present your section. To Siti Hasanah, please welcome Siti Hasanah. Okay, go ahead to present your section.
Okay, next about history of WHO. The World Health Organization (WHO) is a specialist agency of the United Nations that is concerned with international public health. It was established on 7 of April 1948 and is headquartered in Geneva, Switzerland. The WHO is a member of the United Nations Development Group. Its predecessor, the Health Organization, was an agency of the League of Nations. The constitution of the WHO was signed by 61 countries on 22 of July 1946, with the first meeting of the World Health Assembly. It incorporated the Office International de Hygiene Publique and the League of Nations Health Organization. The WHO play a leading role in the eradication of smallpox. Its current priorities include communicable disease, in particular HIV or AIDS, Ebola, malaria, and tuberculosis, as well as the mitigation of the effect of non-communicable disease such as sexual and reproductive health, development and aging, nutrition, food security and health eating, occupational health, substance abuse, and driving the development of reporting, publication, and networking. The WHO is responsible for the World Health Report, the Worldwide World Health Survey, and World Health Day. The International Sanitary Conference, originally held on 23 of June 1851, were the first predecessor of the WHO. A series of the 14 conferences that last from 1851 to 1938. The International Sanitary Conference worked to combat many diseases, chief among them cholera, yellow fever, and the bubonic plague. The conference were largely ineffective until the 7th in 1892, when an international sanitary convention that dealt with cholera was passed. 5 years later, a convention for the plague was signed, in part as a result of the success of the conference. The Pan-American Sanitary Bureau and the Office International de Hygiene Publique were soon founded in 1902 and 1907, respectively. When the League of Nations was formed in 1920, they established the Health Organization of the League of Nations. After World War II, the United Nations absorbed all the other health organizations to form the WHO.
Alhamdulillahirrabbilalamin. Thank you so much. Thank you so much for telling the class, telling the audience about what is the history behind World Health Organization. So let's move to the next section. It is a function of a World Health Organization who will be presented by Yuni Sobariah. To Yuni Sobariah, I present you to begin the presentation about section 3, the main section of this presentation. It's about function and role of World Health Organization.
Okay, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Hello everyone, my name is Yuni Sobariah. After discussing about the biography and history of World Health Organization, we will then discuss about the function and roles of World Health Organization. Okay, just get to the discussion about function. The function of the organization shall be A. To act as the directing and coordinating authority on international health work. B. To establish and maintain effective collaboration with the United Nations, specialized agencies, governmental health administration, professional group, and such other organizations as may be deemed of appropriate. C. To assist government upon request in strengthening health service. D. To furnish appropriate technical assistance and in emergencies necessary at upon the request or acceptance of government. A. To provide or assist in providing upon the request or the United Nations health service and facilities to special group such as the privileged or of trust territories. F. To establish and maintain such administrative and technical service as may be required, including epidemiological and statistical service. G. To stimulate and advance work to eradicate epidemic, endemic, and other diseases. H. To promote in cooperation with other specialized agencies where necessary the prevention of accidental injuries. E. To promote in cooperation with other specialized agencies where necessary the improvement of nutrition, housing, sanitation, recreation, economic or working condition, and other aspects of environmental hygiene. J. To promote cooperation among scientific and professional groups which contribute to the advancement of health. K. To propose convention, agreement, and regulation and make recommendation with respect to international health matters and to perform such duties as may be assigned thereby to the organization and the consistent with this objective. L. To promote maternal and child health welfare and to foster the ability to live harmoniously in a changing total environment. M. To foster activities in the field of mental health, especially those affecting the harmony of human relations. And to promote and conduct research in the field of health. And last, O. To promote improved standard of teaching and training in the health, medical, and related profession.
Next, about the role of the health organization. 1. Keeping healthy by helping to limit infectious diseases. 2. Providing health assistance to countries in need. 3. Helping to improve the welfare and health of mothers and children. And last, 4. And encouraging and assisting the implementation of research in the health sector.
On May 23, Indonesia officially became a member of World Health Organization until now. In the 68 years since Indonesia officially became a member of World Health Organization. World Health Organization has provided support for many healthy programs in Indonesia, especially in increasing the capacity of institutions and individuals to support national health policies and global commitment. Play a role in helping the government to overcome the rampant circulation of counterfeit drugs through collaboration with the Ministry of Health and the Food and Drug Administration and non-governmental organizations such as non-governmental organizations to collect data which is then submitted and used by the Indonesian government to make a policy in the health sector with regard to counterfeit drug. World Health Organization also has a role in overcoming the bird flu virus in Indonesia. Avian influenza is a contagious disease caused by bird type A strains of influenza virus. This disease has been identified since 2003 in China and Vietnam. In 2005, bird flu began to enter the territory of Indonesia and began to take victims, and it was declared 13 people dead due to bird flu. In this case, World Health Organization has provided assistance to Indonesia in the form of 22 ambulance units and scholarship for 40-aged students to conduct epidemiological field training. World Health Organization also asked the Indonesian government to submit avian influenza virus samples to be used as research, and provided assistance in the form of 36,000 boxes of Tamiflu. World Health Organization also assists in improving surveillance, management of disease attack, and setting up hospitals.
Okay, thank you so much for your presentation, Yuni Sobariah. And let's move to the next section. It's the section 4 about World Health Organization programs that will be presented by myself. And let's take a look to the slide. This is WHO program. It's so many programs because World Health Organization is covered all around the world. All health organization around the world. So it has so much programs that you could see on the slide. The first is just like blindness prevention and control. After that, disabilities and rehabilitation, equality and social determinants, and so many more is about health or health services. Yeah, because World Health Organization is the organization who established for covering all the health or health services in around the world. So, you can see in the slide it is so many programs that. Okay, let's move to the next slide. It is about World Health Organization program in Indonesia right now, because we are on an emergency situation that our country is infected by COVID-19. Yeah, because our country is being infected by the COVID-19 virus, so World Health Organization has its own role to prevent the spread of the COVID-19. So if we see that the World Health Organization has provides 1 million antigen detecting rapid diagnostic test kits to accelerate COVID-19 testing in Indonesia. So the antigen rapid test is also provided by the World Health Organization. This is one of some program that we have seen on the previous slides, because so many programs that is the example of the one of program. And let's move to the next section. It is a collaboration between the Ministry of Health in Indonesia and World Health Organization have a collaboration to have a quality assurance for COVID-19 study in the laboratory. So World Health Organization have their own responsibility to prevent this COVID-19 virus, because they are the main organization in the world who covered all the health and health services in any other country. So, if this pandemic are really gone, it is because the country and all other country are being worked together in the World Health Organization. Yeah, maybe that's all from me in this section, and thank you for your attention. And me as the moderator in group 4, I'm permit to leave this meeting. Thank you. If you have any other question, just drop it below in the comment section or in our learning management system in Organization and Administration International. Thank you.